Dear ANA community, what do you mean by Pradoshaja Vikara? How to identify Pradoshaja Vikara in the patients? What are the signs and symptoms of Pradoshaja Vikara? These are the topic of discussion of today's video. Dear community members, press the like button and spread this particular video to maximum number of true Nidana learners, or at least one Nidana learner, so that we can make a huge movement in the out of this particular small message. Don't forget to press the bell icon so that the YouTube algorithms will be fetching you the right information at the right time for the right purpose. When you talk about the term Malapradoshaja Vikara, that refers to the three different terms Mala, Pradoshaja and Vikara. The term Mala, as per Ayurveda, Malini Karanan Malaha, anything that is actually disturbing the whole body dysfunction, that is being termed as Mala. Pradoshaja in the sense where we are going to see the affliction as such, and Vikara refers to the clinical signs and symptoms. In other words, or the disturbances. In other words, if you look into the three terms together, the term Malapradoshaja Vikara refers to the signs and symptoms observed in an individual when there is disturbances in the Mala is going to take place. What are the Malapradoshaja Vikara? The Charaka Samhita says, Malan Ashritya Kupita Bheda Shosha Pradushanam Dosha Kurvanti Sangotsargavati Vacha. If you split this, Malan Ashritya Kupita Bheda Shosha Pradushanam Dosha Kurvanti Sanga Utsargau Ativacha. When you think about this, Bheda, that is specifically used for the Purisha, or what we can say the fecal matter. Whereas the term Shosha refers to the almost all the Mala, Mutra, Purisha or Sweda as such. Whereas the term Pradushana refers to the vitiation of these Mala in cases of the dosha dominance. When there is Vata dosha dominance, what might be the features of the Mala? Pitta dosha dominance, what might be the features of the Mala? That may be Purisha, Mutra or Sweda as such, or the other Dhatu Mala. And what may be the the color of this Mala when there is Kapha dosha vitiation. Whereas Ativa Sanga refers to the less formation, whereas Ativa Utsarga that refers to more formation. When you think about the term Mala, it is being mentioned as the different Dhatu Mala also that is being mentioned there. In that particular sense, whenever if you speak about the Mala Pradoshaja Vikara, we have to think these the Malas not only related to Mutra, Purisha and Sweda, even other Dhatu Malas should also be considered when you think about the Malapradoshaja Vikara. When you think about the individual description, Bheda, as discussed earlier, this refers to Tatra Bhedaha Purishasya. So that means, so here that is being mentioned that unformed stool. The normally formed stool, it could be what we can say the having the pultaceous consistency. This may be what we can say the type 4 that can be considered as the normal stool. Whereas these are the type 5 to type 6 based on the Bristol stool chart. They are categorized under the, what do you say that, the unformed stool. Here what we can say the Purishasya Bhedaha. Shosha refers to the dryness or hardness of the metabolites. So here what we can say type 1 to type 3, what we can say the Purishasya Shoshaha. So here we are going to observe the hardness that sometimes even we can see the fecoliths also. When you think about the Shosha in terms of the Mutra, the person will be having the renal stone. When you think about the Shosha in terms of the earwax, which is considered to be one type of the Kamala, or what we can say the mala of the mamsa dhatu. So there will be the hardness of the ear wax that may be observed. So here what we can say, the uh, shoshaha, that is the mala of the mala. Pradoshana. So here pradoshanam tu pradushta varnadi yuktatvena prakrita varnadi upaghatah. So when you think about this, so there may be the vata dosha dominance, pitta dosha dominance, kapha dosha dominance in terms of the mutra, purisha, or others, what we can say, the nasal secretions, eye secretions, wax, etc. etc. So we are going to observe the pradoshana there. Ativa sanga. So that is apravrittihi. When you think about this, no formation of urine. Sometimes what we can say, the acute retention of urine. Constipation or obstipation. The term constipation we know, wherein the person will be having the passage of hard stools, whereas obstipation refers to absolute constipation, wherein the fecal matter as well as flatus will not be passed. So that is what we can say, the obstipation. And when you think about the next aspect, that is loss of sweating and less formation of the malakhamala, that is the less formation of the tears or less formation of the nasal secretions, less formation of the ear wax, etc. etc. So that is what we can say, ativa sangaha. Whereas ativa utsargaha, so that is ati pravrittihi. So that is excessive passage of mutra, that is polyuria, excessive passage of the purisha, diarrhea, excessive sweating, what we can say, the diaphoresis, and excess formation of the ear wax, etc. etc. or the secretions, that is tear formation, etc. that is considered under ativa utsarga. When you think about the summing up, mala pradoshaja vikara, so that is the description available in Charaka Samhita. This actually refers to the signs and symptoms that are being observed when there is the mala disturbances or the affliction of the mala is being noticed. So the description goes like this: Malan ashritya kupita bheda shosha pradushanam dosha malanam kurvanti sangotsargavati vaja. So that means the mala, it need not be the trimala only, mutra purisha sweda, or any of the mala that is being present inside the body. If they are going to get afflicted, these are the lakshana that can be observed there, wherein the bheda, that is specifically used for purisha, whereas the other aspects, that is shosha, pradushana, utsarga and sanga, that are attributable to other malas also. Dear ANA community, that's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. What is the one video that you'd like to hear in the coming days in this particular channel? Mention in the comment box below, and spread this particular video to maximum number of true Nidana learners, or at least one true Nidana learner, so that we can make a huge movement out of this particular small message. Don't forget to press the bell icon so that the YouTube algorithms will be fetching you the right information at the right time for the right purpose. Something more in the next video. Thank you.